Good morning. Hope you're doing well today. Today we are going over body composition. This is in chapter 11. Here we go. Anthropometry is a method used to assess body composition by measuring various body dimensions. Here are the steps involved in conducting anthropometric measurements for body composition assessment. Height measurement. You're going to use a stadiometer or wall-mounted measuring tape to measure the person's height. Instruct the person to stand straight without shoes with their back to the wall or the stadiometer. Ensure that their heels, buttocks, shoulders, and head are in contact with the wall. Record the height in centimeters or inches. Weight measurement. Using a calibrated scale to measure the person's weight, instruct the person to remove any heavy clothing or accessories and stand on the scale with minimal clothing. Ensure they distribute their weight evenly on both feet and stand still. Record the weight in kilograms or pounds. Now, the body mass index, or BMI, is a commonly used measurement to assess body weight relative to height. It is calculated by dividing an individual's weight in kilogram by their height in meters squared. The formula for calculating BMI is your weight in kilograms divided by your height in meters squared. Here are the standard BMI categories. Underweight is considered to be a BMI less than 18.5. Normal weight is a BMI between 18.5 and 24.9. And overall BMI between 25 and 29.9. And obesity, there are different classes. So a class 1 obesity is a BMI between 30 and 34.9. Class 2 between 35 and 39.9, and class 3 obesity is severe with a BMI of 40 or over. It's important to note that while BMI is a widely used indicator, it has some limitations. It does not differentiate between fat mass and muscle mass. So individuals with high muscle mass, such as athletes, may have a higher BMI without necessarily having a high body fat percentage. Additionally, BMI does not account for differences in body composition based on age, sex, or ethnicity. BMI should be interpreted as a screening tool and not as a definitive measure of an individual's overall health. It is often used in conjunction with other assessments such as waist circumference, body fat percentage, and medical history to provide a more comprehensive evaluation of an individual's health status. The waist to hip girth ratio is a measurement used to assess body fat distribution and the associated health risks. It's not truly a measure of body composition. It compares the circumference of the waist to that of the hips and provides an indication of how fat is distributed in the body. To calculate the waist to hip ratio, you follow these steps. First, you want to measure waist circumference. Using a flexible measuring tape to measure the circumference of the waist, place the tape around the waist at the level of the navel or the narrowest point between the ribs and the hips. Make sure the tape is not snug but not too tight, and measure to the nearest centimeter or inch. Second, you measure hip circumference. Here you're going to take the hips at the widest part of the buttocks. This is typically around the buttock prominence. Again, using a flexible measuring tape, and measure to the nearest centimeter or inch. Then you're going to calculate the ratio. So you divide the waist circumference by the hip circumference to obtain the waist to hip ratio. And you can see the formula is waist to hip ratio. You're going to take waist circumference, divide it by hip circumference. The ratio can be expressed as a decimal or as a percentage. The interpretation of waist to hip ratio can vary based on gender and population-specific guidelines, but here are some general categories. So you can see here for men, ages 20 to 29, anything below 0.83 is considered to be low. Moderate would be 0.83 to 0.88, and high would be 0.39 to 0.94. And above that, a very high would be anything over 9.4. I'm targeting that age group because that's the age group I'm working with right now. For females 20 to 29, anything below 0.71 is considered to be low. Women at a moderate rate at 7.1 to 0.77. High risk would be more of 0.78 to 0.82, and anything above 0.82 would be very high for women. Now, interpreting the waist to hip ratio, it provides information about body fat distribution and the associated health risks. Generally, the higher the waist to hip ratios indicate more abdominal or central adiposity, which is associated with a higher risk of obesity-related health conditions such as cardiovascular diseases, type 2 diabetes, and metabolic syndrome. It is important to note that the waist to hip ratio is just one measure of body fat distribution and should be considered in conjunction with other assessments such as BMI, body fat percentage, and overall health evaluation. Skin fold measurements are used to estimate subcutaneous fat thickness. The most commonly measured sites include the triceps, biceps, subscapular, and suprailiac areas. Use calibrated skin fold calipers to measure the skin fold thickness. Grasp the skin fold firmly between your thumb and forefinger and approximately 1 centimeter above the intended measurement site. Apply the calipers perpendicular to the skin fold, ensuring that the jaws are in the middle of the fold. Release the caliper slowly and record the measurement in millimeters. You repeat the measurement 2 to 3 times at each side and calculate the average. Skin fold measurements, also known as skin fold thickness, are a common method used to estimate body fat percentage and assess body compositions. The skin fold measurements involve using specialized calipers to measure the thickness of skin fold sites at various locations on the body. These measurements are then used to calculate body fat percentage using specific equations or formulas. Here are some key points about skin fold measurements. They're typically taken at specific sites on the body, which may vary depending on the chosen body composition assessment protocol. Commonly measured sites include the triceps, biceps, subscapular, suprailiac, abdomen, thigh, and calf. The number of sites measured can vary, ranging from 3 sites measurements to more comprehensive protocols that include multiple sites. The skin fold measurements require proper technique to ensure accurate and consistent results. The skin fold site is pinched and gently pulled away from the underlying muscle and fat tissue. The calipers are then applied to the skin fold perpendicular to the fold, and the measurement is taken. It's important to keep the fold elevated while taking the measurement to ensure accurate results. Once the skin fold measurements are taken, they are plugged into specific equations or formulas to estimate body fat percentage. Different equations may be used depending on the chosen body composition assessment method. Commonly used equations include the Jackson-Pollock, the Durnan-Wormsley, and Slaughter equations. Skin fold measurements provide an estimation of body fat percentage, but are subject to some limitations. The accuracy of skin fold measurements depends on factors such as the skill and experience of the tester, the equipment used, and variations in skin fold compression and fat distribution. It is important to note that skin fold measurements may not accurately represent overall body fat distribution or the distribution of internal fat deposits. Skin fold measurements are more suitable for assessing changes in body composition over time rather than providing precise absolute values. To ensure accurate and reliable skin fold measurements, it's recommended that you train and be able to do this on a regular basis. Follow your standardized protocols using calibrated calipers and apply proper technique to minimize measurement errors. Additionally, you want to consider individual factors such as hydration status and skin fold site selection for consistent and accurate results. So you're using a standardized skin fold measurement technique such as the Jackson-Pollock or Durnan-Wormsley method, following the specific protocols and landmarks for each site to ensure consistency across different individuals and testers. You regularly want to calibrate the skin fold calipers to ensure accurate measurements, so follow the manufacturer's instructions for calibration or use a calibration tool provided with the calipers. Use the recommended skin fold measurement sites based on the specific equation or protocol you are following. Ensure the site is clearly marked and consistently measured in subsequent assessments. Clear the skin with an alcohol wipe or dry cloth to remove any oil or lotion or sweat that may interfere with the skin fold measurement, and allow the skin to dry before performing the measurement. Use the appropriate grasp technique when taking the skin fold measurement. So grasping the skin fold firmly between your thumb and forefinger, approximately 1 centimeter above the intended measurement site. Ensure a vertical pinch of skin and subcutaneous fat, avoiding muscle tissue. It really depends upon what site you're using as to whether it's a vertical, diagonal, or horizontal. You're going to apply consistent pressure with the skin fold calipers when measuring the skin fold thickness. Excessive pressure may compress the fat tissue, resulting in underestimation, while insufficient pressure may lead to overestimation. And take multiple measurements at each site to ensure accuracy and reduce measurement error. Typically 2 to 3 measurements are recommended. If the measurements vary significantly, take additional measurements until consistent values are obtained. Allow a brief rest period, approximately 15 to 30 seconds, between repeated measurements at the same site to minimize the effect of skin compression on subsequent measures. And document all measurements accurately and clearly. Record the site, measurement values, and any relevant notes or observations. Skin fold measurements require practice and experience for reliable results. Ensure that you have trained with this proper technique and have sufficient experience in taking skin fold measurements. The skin fold measurements provide, again, an estimation of body fat percentage and may have limitations in certain populations or individuals with atypical fat distribution. For more accurate assessments, advanced techniques like dual energy X-ray absorptiometry or DEXA, or the bioelectrical impedance analysis, or air displacement plethysmography or ADP can be used. When assessing body composition using a 7-site measurement approach, the following sites are commonly used. The chest, which you see here in the upper left-hand corner. The chest is taken diagonally, halfway between the nipple and the shoulder blade. This measurement estimates the fat distribution in the chest area. Now, with females, you may have to guesstimate, and so because it is a very sensitive area, and you want to be very careful with that. The mid-axillary, the skin fold is taken at the mid-axillary line, which is a vertical line at the midpoint between the armpit and the top of the hip bone. You see here at the second picture on the left at the top. Now, the triceps skin fold is measured on the back of the upper arm, halfway between the shoulder and elbow. It's taken vertically parallel to the arm. Ideally, you want to measure these sites and put a mark in that site so that you're making sure that you are consistent with your measurements. The subscapular, the far right-hand side at the top. This skin fold is taken below the inferior angle of the scapula or shoulder blade on a diagonal line. The suprailiac on the lower left-hand corner, the skin fold is taken just above the iliac crest or the hip bone at the front of the body. In line with the natural waistline, it's usually about 1 to 2 centimeters above the anterior superior iliac spine and is taken nearly horizontally, but it follows the natural fold lines of the skin. A diagonal fold parallel and superior to the iliac crest. The abdomen, the skin fold is taken vertically 1 inch to the right of the belly button. And then the thigh, the skin fold is taken on the front of the thigh, midway between the hip and the knee on the anterior aspect of the thigh, making sure that your leg is at a 90-degree angle and resting on the floor. And to add a little bit more, the calf skin fold is taken on the posterior aspect of the lower leg at the widest point of the calf muscle. It's typically measured midway between the knee and the ankle on the medial side of the leg, which you see in the picture here on the right. Now, there's also the bicep skin fold that you can take. It's taken on the front of the upper arm, halfway between the shoulder and the elbow. These sites provide a more comprehensive assessment of body composition, of capturing fat deposits from various areas of the body. They're often used in research or clinical settings to estimate overall body fat percentage or track changes in body composition over time. It is important to note that the accuracy of skin fold measurements depends on the skill and accurate experience of the tester, as well as proper adherence to standardized measurement techniques. for accurate results, you want to make sure that you are performing these and on a periodic basis so that you're comfortable with the established protocols. The most commonly used skin fold sites for assessing body fat percentage in men and women include, for women, it's the triceps, the suprailiac, and thigh. And again, it depends upon which formula you are using. For the men, it's going to be the chest or pectoral skin fold site, abdominal, and thigh. It's important to note that the choice of skin fold site is going to depend on the specific body composition equation or method you're using. Different equations may incorporate different skin fold sites based on their research validity and relevance to the specific population being assessed. Advantages to using skin fold calipers to measure body composition: it's cost effective. Your skin fold calipers are relatively inexpensive compared to other methods of body composition analysis, such as DEXA scans or hydrostatic weighing. This makes them more accessible for researchers, fitness professionals, and individuals who want to monitor their body fat levels. They're portable and convenient. They're compact and easy to carry, allowing for on-the-spot measurements in various settings. And they don't require specialized equipment or dedicated facility, making them suitable for field work or home use. They're non-invasive and generally considered safe. They do involve gently pinching the skin and underlying subcutaneous fat without the need for needles, radiation, or discomfort. Skin fold calipers directly measure the thickness of subcutaneous fat at specific sites on the body. This provides an estimation of total body fat percentage and allows for tracking changes in fat distribution over time. And they can be used in various populations and age groups, including athletes, general populations, and children. They're applicable across different fitness and health settings such as sport performance, weight management, and research studies. With practice, they can be performed quickly, taking only a few minutes, and can be repeated easily to obtain multiple measurements for increased accuracy and reliability. It is important that they do have limitations. The accuracy of the measurements depends on the skill and experience of the person taking the measurements, and they may not accurately capture visceral fat stored around internal organs, or provide a complete picture of body composition. It's often recommended to complete skin fold measurements with other methods for a more comprehensive assessment. While they have their advantages, they also have their limitations and disadvantages. And as we've mentioned, it's really important that you're using proper technique and experience, getting the good experience. Inaccurate measurement technique and improper calibration of the calipers or inconsistent placement of the calipers can lead to less reliable results. Even with proper technique, different individuals may obtain slightly different measurements due to variances in how they grip the skin fold or interpret the caliper reading. This variability can affect the reliability and consistency of the measurements, especially when comparing results from different operators. Most skin fold measurement equations were derived from specific populations and may not accurately estimate body fat percentage for individuals outside those populations. That can lead to potential inaccuracies when using generalized equations for diverse populations. Skin fold measurements provide an estimate of subcutaneous fat located directly beneath the skin, and so, as we said before, they don't necessarily account for visceral fat that's stored around the internal organs or fast distribution in other body areas, such as the trunk or extremities. So that limitation may impact the accuracy of body fat percentage estimates with atypical fat distribution. Inaccuracy with extreme body compositions. Oftentimes it's very difficult to get accurate results for individuals that are very low or very high body fat percentages. Extremely lean individuals may have thin skin folds that are difficult to measure accurately, while individuals with obesity may have thick skin folds that exceed the measurement range of the calipers. And some individuals may experience mild discomfort or pain when their skin is pinched during skin fold measurement. It can be a concern, particularly for individuals with sensitive or delicate skin. Skin fold measurements primarily focus on estimating body fat percentage. They don't provide information on other important components of body composition, such as lean muscle mass or bone density. So it's important to consider these limitations when using skin fold calipers and to understand that they may not provide a complete assessment of body composition on their own. Combining them with other methods and considering multiple factors can yield a more comprehensive understanding of body composition. Bioelectrical impedance analysis, or BIA, is a technique used to estimate body composition by measuring the electrical impedance or resistance of body tissues. BIA works on the principle that different tissues in the body conduct electrical currents differently due to variations in water content and electrolyte concentrations. There are different BIA techniques used to assess body composition. BIA is a convenient and non-invasive method for estimating body composition. However, it is important to note that BIA has certain limitations. Factors such as hydration status, body temperature, skin resistance, and variation in body shape can influence the accuracy of BIA measurements. BIA is best used for tracking changes in body composition over time rather than providing precise absolute values. Some pre-testing guidelines. You want to make sure to remove any jewelry or metal objects from the body as they can interfere with the electrical current. You want to make sure that they refrain from eating or drinking within 4 hours of the test. And they really should not exercise within 12 hours of the test. No alcohol consumption within 48 hours and no diuretic medications within 7 days of the test. You don't necessarily want to test female clients who perceive they are retaining water during their menstrual cycle. And you want to ask the clients to void their bladder within 30 minutes of the test. As far as equipment setup, you set up the BIA device according to the manufacturer's instructions, connecting electrodes, if appropriate, to the appropriate ports on the device, and ensure that the electrodes are clean and in good condition. Ask the individual to remove shoes and socks if necessary, and instruct them to stand barefoot on the BIA device's foot plates or hold the handheld device with electrodes. Ensure the individual's feet are properly aligned on the foot plates and that there is no contact between the feet. Enter any required information into the BIA device, such as age, sex, and height. This information may be used in the calculation for estimating body composition. Then instruct the individual to stay still and avoid any movement during the measurement. Initiate the BIA measurement, which involves the device sending a safe and low-level electrical current throughout the body. The electrical current should pass through the hands and feet, and the impedance or resistance of the body tissues is measured. Once the measurement is complete, the BIA device will display or provide the results. Take note of the estimated body composition parameters provided by the device, such as fat mass, fat-free mass, or body weight values, and document the results in a record-keeping system for future reference. Oftentimes, they'll give you a great printout that shows you exactly what kind of composition you have for each body part, like your right arm and your left arm, and show the differences there. It's important to note that the specific steps and instructions may vary depending on the type and model of the BIA device being used. Always follow the manufacturer's guidelines and instructions for accurate and reliable results. And that's all that I have for you today. I look forward to talking with you again. We'll continue the conversation in Chapter 11 over testing procedures. Thanks. Have a great day.